What's this all about, Rob?
So this is about how Public Health England calculates who has died from coronavirus and whose deaths get added on to that tally that we've grown used to seeing day by day that currently stands at around 45,000. Now, the issue is that the way it's being counted at the moment means that if you are diagnosed, you test positive for coronavirus, even if you go into hospital, but then you recover and you come out, and then 2 months later, say, or a period of time later, you then die of something completely unrelated to coronavirus, your death will still be added to that coronavirus death tally. So the example that was given to me by a government source was basically if you had tested positive in February for coronavirus, you'd recovered, you'd been fine for the last few months, but then you'd been hit by a lorry or hit by a bus yesterday and died, your death would still be added on to that coronavirus tally, even though clearly, even though you may have had it, clearly your death is nothing to do with coronavirus at all. So essentially what this means is that tally that we've been used to getting from the government every day when they are updating us on death figures is likely to be out, is likely to be too high, which means that 45,000 figure that we are currently looking at in terms of deaths from coronavirus is likely to be wrong.
So let me start by saying this. I'm going to start with the most important things right off the bat. There's one thing that we can be absolutely certain of scientifically, and it's the following thing. You see, a death is a death, whereas when you try to attribute cause of death, it becomes political. Even when a medical doctor tries to attribute cause of death in a complicated situation like this, where you have comorbidity conditions and everyone's arguing about whether the tests are valid and so on, the attribution of the death, of the cause of death, is typically biased and is very political. And this is well known by epidemiologists. It's always been this way. And it's affected by, what the public is thinking, what the media are saying, and so on. So the way to get around that is to look at total deaths, all-cause death. So we look at all-cause mortality on a per-week basis. So every week, how many people die, let's say, in Canada, or in a given state, or in a given province, or in a given European country. You look at so you make a graph of the total number of deaths per week as a function of as the weeks advance. And what you find when you do that is that every winter in the mid-latitude countries in Europe and North America, every winter there's a large hump of additional deaths above a kind of summer background. And we can call this the winter burden of deaths. And this is well known. It's always been there. It's always happened. It's true with animals that live in nature, and it's true with humans that live in those mid-latitude countries. So why is that? So science has come to understand that the main reason most probably is because of these darn viruses that have been with us for millions of years that cause respiratory diseases. Because these viruses are transmitted by very small aerosol particles that are suspended in the air. And they can only be suspended in the air effectively and for a long time if the absolute humidity is very low. That's why it happens in the winter. So in winter, all of these viruses, which are very similar one to the next, irrespective of the strain, all of these viruses that cause respiratory diseases are highly contagious and transmit in the winter when the air is dry. That's why you get this extra burden of death, because as soon as you breathe in these aerosols, they infect your lungs and they give you this nasty respiratory disease, then your immune system is in high demand. You have to have a lot of metabolic energy and you have to fight that infection. And that energetic demand in your metabolism is extreme. Your body will even shut down other functions in order to meet that demand. And so anyone who is already fragile and already spending a lot of resources within their body to fight other infections or other conditions is at risk of dying. That's why it's the elderly people who have comorbidity conditions that die under this extra stress of the respiratory disease infection. Okay? So even people who have heart conditions will die as a result of adding on this respiratory disease and so on. So that's why you get this large extra hump in the wintertime. I don't know if you want me to show you what a graph looks like. I think many of you have seen it. I guess I could. Okay, I've got one here. This is what these humps look like, okay? All right, so every winter you get an extra bump of these deaths. This is for the United States as a whole. So that's what the graph looks like as you go year to year every winter like that. And you can see that the extra number of deaths, the extra size of these bumps is always about the same. It's not dramatically different from year to year. These viruses, and there are many, many of them, and they coexist with us, and they always have. If they can be transmitted, they will be transmitted, and they're mutating all the time, and you always get extra deaths in the winter. Okay? So the very first thing, once you understand all that, the very first thing we have to say scientifically on a rigorous basis is this year, this winter, under COVID-19, there have not been more deaths than usual. In other words, the winter burden total deaths has not been greater, statistically speaking. It always varies a little from year to year, but in terms of is it significantly greater? Is something special happening? It's not. That's the very first point I want to make, is that this is not a killer pathogen that is unusual in terms of how many deaths it causes. Nor is it unusual in terms of how it is transmitted, how it acts. It's one of hundreds and hundreds of different viral respiratory disease viruses, and they mutate and they change, and they're always with us. And typically a person who is infected is often infected, when they analyze it, they find this out, is often infected by more than one of these viruses at any one time. So it's not like you just get one. They're all transmitting, they're all there, and it puts an extra burden on our immune systems in the wintertime. Okay? And so it's just that band of mid-latitude where this transmissivity is high. If you go too far north to very cold, it doesn't transmit anymore. And if you go towards the equator where it's hot and humid, it doesn't transmit. So it's Europe and North America in the northern hemisphere, and the mid-latitude countries in the southern hemisphere, but in their winter, which is our summer, okay, when the air is dry there. So they get this extra burden during our summer. And that's normal. This is known. It's been known for decades. It's been studied for decades. It's been explained in the scientific literature for at least a decade in some detail. Okay, so that's the situation. There was never anything unusual or special. Of course, a virologist is always looking to identify a new strain or a new type of virus because they get recognition for that. So there is some institutional and professional rewards for finding a new virus and giving it a name and claiming that you've discovered something and so on. But that's part of what drives this. And in addition, in this case, you've got a strong institutional impetus. You've got a whole apparatus that is waiting for the next new virus to be claimed by some virologist and jump on there if they can, if they see the conditions are right, to call it a pandemic and to make everybody crazy. So they've been preparing this for a while. But they could have done it with anything. And if you could call it anything, and it'll happen every winter, and it won't be a second wave, it'll be the usual winter wave. Okay? It's going to happen again. There will be these kinds of respiratory diseases next winter, and they will be in greater number than they are in the summer, and there will be extra deaths associated with it. It's unavoidable.
Let's say that, and this is an entirely hypothetical scenario, that that new coronavirus was not detected. No one had noticed it, and no one had found that this is a new entity. And eventually, it killed 10,000 people in the U.S. based on this presentation that you have respiratory distress syndrome, acute respiratory distress syndrome. Most likely, you would have counted that within the bin of influenza-like illness, which, as I said, is killing already 30 to 60,000 people. 10,000 more or less would be very difficult to pick. It would be well within the range of statistical noise. And probably no one would have noticed, or perhaps some experts would have said that this year influenza seems to have higher activity, and maybe give some advice to increase the vaccination rate. If it were 10,000 deaths, it's very likely that it would not have been noticed. People would not have paid attention. If there were some news story, as I say in my article, it would have attracted less attention than a game between two indifferent NBA teams.
So that's the first thing, is that nothing special happened. It was a fake event, if you like, in the sense that it was given a special name and it was used in propaganda to frighten us to think that there was a particularly dangerous thing happening that was very unusual and unseen previously. That's all a big lie. Okay, I'm personally very convinced of this. I've looked at all the data, read so many of the articles as they come out. This has been a huge fabrication. Okay, that was the first point I wanted to make. The second point is also important, and it's the following point. I said that the humps are always about the same size, which means the total burden of death in the winter is always about the same. However, in some jurisdictions, in some states, and in some European countries, all of a sudden there's this very, very fine, sharp peak that shoots up. And I've called that the COVID peak. And so I wrote a big paper to try to analyze where does that peak come from and what's it due to. So the area of the peak is not big because it's so narrow. So you don't have a total number of extra deaths that's significant. But there is that peak there. So it means that there was an acceleration of the deaths at that point. A lot of people died very quickly within about 3 or 4 weeks. That's the width of that peak. And it was a very dramatic event in some jurisdictions, only where they did certain things. Okay? So when I look at that peak in the data across the world where they're reporting this kind of data, what I found was that the peak kicks in, starts up, always at exactly the same time, no matter where you are in the world. It fires up immediately after the pandemic was declared. Okay? Week 11 of the season, week 11 of the year, they declare the pandemic. The World Health Organization tells all the states, you have to get ready for this catastrophe. People are going to flood the hospitals. You have to get your hospitals ready. We're telling you now it's a pandemic. And immediately, as soon as they said that, didn't matter where you were on the world, on the planet, across oceans and everything, synchronously, everybody at the same time had the start of that very sharp, large peak, which was an extra number of deaths. So what I concluded in my paper, and this peak is not natural. A peak like this has never been seen for any of these respiratory viruses, okay? It's not natural for the following reasons. It's too narrow. A viral infection of this type that normally spreads in a society will never be that narrow. You always get these broader peaks. Even the sharper features that you see in this curve from winter to winter, when you do have a sharper feature, the width of that is much greater. The half width at half maximum, we call it, is much greater than this COVID peak. So it's typically more like 12 or 14 weeks rather than 3 or 4 weeks. So it's too narrow to be a natural peak, and it's happening synchronously everywhere at the same time, which is crazy. It can't be an accident. And it's happening too late in the season. There has never been, in the recorded history of mortality, there's never been a sharp peak like this late in the winter season. Anywhere, at any time. So it's a completely artificially created situation where immune vulnerable people, their deaths were accelerated by what we did to them. So it's a completely artificially created situation where immune vulnerable people, their deaths were accelerated by what we did to them. And what did we do to them? Well, we isolated them from their families. We closed them into institutions. We closed the doors of the institutions. We didn't let the air come out. The air filled with these aerosol particles containing the virus, and we basically infected them all by closing them in and stressing them more than they would be normally because they were isolated, they were not cared for as well, and their family couldn't see them. And they were frightened by the fact that there was this horrible pandemic that they were hearing about. Now, that kind of psychological stress is known scientifically to be a major cause of faulty immune responses and other diseases, causing other diseases as well. So you don't do that, and they did it. And so I believe that's the mechanism whereby they accelerated the deaths of immune deficient, fragile people who would have died in the many weeks and months later, eventually in a natural way, but instead they accelerated their deaths by doing this. That's my conclusion of what happened there. And what's interesting is that you don't get this peak in some of the states in the United States. There are large states where there is no sign of this peak, this unusual peak, and other states where it's very prominent, like in New York. So far I've made 2 points. One is this is not an unusual killer, and point 2 is governments did intervene in a way that was reckless and that killed people basically because it accelerated their deaths. Now, in a situation like that, the government is going to want to hide its crimes. This is criminal, and it's irresponsible, and it was not based on science, and they didn't use their own experts. They went on what the World Health was saying. They relied on that authority information, and so you need to cover that up. And how do you cover that up? You convince everyone that this really was a dangerous pandemic. What's the best way to convince everybody that we really had a killer here, that we came close to all dying and so on? What's the best way? Well, convince them that they have to wear a face mask. If you as an individual are so frightened that you're going to go and put a face mask on in the middle of summer, you are personally investing in the belief of that lie. And that is a powerful psychological way of convincing you that there was this danger and that what we need to do to save ourselves is to wear that masks, and the government didn't do anything wrong and they did the best they could, and thank God they told us what to do. And so the mask, I believe that this is the reason the establishment is so vehement about wearing masks and is so stuck on this mask idea, because it is a way to invest us personally into this lie and to get us acting this way. And when you see, people think that what you believe motivates what you're going to do, your action, but it also works the other way. Your action largely creates what you believe. Okay, if you agree to do something because someone is scaring you or convincing you with false arguments, the fact of doing it, you're going to be believing that lie. So I think that's what the masks are about. That's pretty much those are the main points that I wanted to make.
So this urgent review has been ordered by the Health Secretary to basically try and sort out this issue and to try and establish actually by how much they have been overcounting their deaths. hugely embarrassing for the government, especially after some of the ordeals that we've seen in terms of counting test data. It now seems that arguably the most crucial figure in this whole coronavirus pandemic, how many people have actually died from the virus, the government's own figures could be way out.
Yesterday evening, news broke of a discovery that Professor Hennigan had made in the statistics, so we thought we'd quickly catch up with him and hear about that beforehand. Professor Hennigan, thanks for doing this.
You're welcome.
So this concerns deaths and the numbers of deaths that are attributed to COVID-19. And this matters because that daily total that is announced for deaths in England affects the whole atmosphere. It affects whether people think that the pandemic is coming to an end or not. You've discovered that daily death total may not actually correlate to people dying from COVID-19. Tell us about that.
But one of the things that we noticed is Public Health England creates lots of confusion because one day, for instance, on the 6th of July, they'll report 16 deaths. And then the next day, there'll be 152 deaths. And at that point, the media takes a notice, starts to get concerned, and you see these reports of hundreds of deaths per day. So we ask questions of what's going on here. And what we noticed is if you look at the way PHE does their reporting, they are reporting anybody who has had a test positive for COVID in the past. Therefore, a death reported today could have occurred in early March. It may not even be related, but the way they're recording it, it assumes that people are thinking, oh, there are over 100 deaths today. Things are getting worse. Now, this will get increasingly confusing as we go into the next winter, because you could have a new outbreak, new deaths, but you're also reporting historical deaths. We may not see that trend in the way that they're currently reporting this.
So you mean if someone had COVID-19 now, recovers, and then dies of something completely unrelated next year,
yes,
that would still be recorded as a COVID-19 death in the current system?
Yeah, and that's why we're saying it looks like you can never recover under the current system, because you could die of influenza, for instance, in January next year, but because you had a positive COVID test, you'd still appear in the figures.
Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing or standards for how they're characterized?
So I think in this country, we've taken a very liberal approach to mortality.
A Minnesota state senator says officials are asking doctors to fill out death certificates with diagnosis of COVID-19, whether the person died of it or not.
Technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death.
As a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates. And I've never really received coaching from the Vital Statistics Agency in terms of how to do a death certificate. But basically, I felt like they were saying, you know, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19.
If you have a subjective fever and you have a headache and you live in Collin County, you now meet the qualifications to be a probable COVID patient. It is remarkable how low the standard is now. But I'm very concerned that we absolutely could see the numbers jump very rapidly in a way that actually is not indicative of what we're seeing here in the community in the public health department.
Even if you see and know what's going on, this one is crazy. It says a recent investigation by local Fox affiliate in Florida found that the Florida Department of Health's data on COVID-19 tests included errors in the rate of positivity. The report showed that Orlando Health had a 98% positivity rate, which means that 98% of the time, anyone they tested was going to be sick. However, when Fox 35 News contacted the actual hospital, they confirmed errors in the reports. Yeah, let's pretend that they're errors. Orlando Health's positivity rate was only 9.4%. Yeah, that's quite an error, right? An error of almost 90%. That is ridiculous.
So the first condition is the very broad definition of COVID and of an infection with a novel coronavirus. And this, as you said, does apply in many other places. I was just looking at the conditions in the UK from the Geriatric Society there, and you can have the sniffles and you're deemed to have COVID. And here it's a little more, smaller, more narrow definition. You can have sniffles and a cough, and then you've got COVID. So these were set right from the beginning of the pandemic. At least in Ontario, they said that anybody, if in a long-term care home specifically, or in a congregate setting for seniors, one person could have one symptom, and then the whole long-term care home would be deemed to be an outbreak, and anybody else who got any sort of symptom was deemed to have COVID. So that means that they've just opened up the door to an outbreak. Anybody who has any symptom is deemed to have COVID. So if they die, they're therefore also deemed to have COVID.
Let's just take someone getting hit by a bus and they collapse a lung and they go into the emergency room and they're there for 15, 20 minutes. Blood work comes back, COVID test comes back positive, and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense.
When we get these startling record number of deaths in Italy, they can't get coffins fast enough. Well, hold on a second. We get this, for example, from offguardian.org talking about this Italian mortality phenomenon. They have a post, Italy, only 12% of COVID-19 deaths list COVID-19 as cause. Report shows up to 88% of Italy's alleged COVID-19 deaths could be misattributed. And they talk about the report, citing Professor Walter Ricciardi, in which he says, the way in which we code deaths in our country is very generous, in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On re-evaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity, i.e. other type of disease. Many had 2 or 3.
See, now that is odd to me because it didn't seem like a COVID death apparently at the time.
I think they're swabbing everybody who goes into that hospital.
Yeah, I understand that, but people die of lots of things.
Exactly.
People have viruses in their bodies, all sorts of things going on. It doesn't necessarily mean that someone has died of COVID just because...
Yeah, no, I fully understand. And if it comes back negative, the post-mortem would be carried out.
So if it comes back positive, they won't carry out a post-mortem, they'll just label it as a COVID death and then we can all move on?
Correct.
Right, okay. Okay, yeah. Thanks for letting me know.
Unfortunately, Mr. Hickey, that's the way that things are being dealt with at the moment, and it's not quite right. No, it's not.
Can the surge in coronavirus cases across the country and the numbers associated with that actually be trusted? Hear me out, because across the internet there have been rumors about people saying they have gone to a testing site in order to get tested for COVID, have left because the lines were too long, and then days later got a call letting them know that they in fact tested positive. The problem was these people say they never got tested in the first place. We decided to take a look into it and put out a call to action asking our viewers only if they had first-hand knowledge of this happening, either with a family member or if it happened to them personally, to let us know so that we could verify whether or not these kinds of things are actually taking place. I can tell you that I live in the state of Delaware and I had an antibody test done that came back negative. A few days later, I got a letter from the Department of Health saying I was positive for COVID, but I did not have a diagnostic test for COVID. In my case, I received a voicemail of a doctor stating that he had my COVID test results. I'd never been tested. The only reason I called him back was because he addressed me directly on the voicemail. When I called him, he insisted I had gone in to test, which was false. I can confirm this has happened. I am a registered nurse in Washington State. Yesterday at work, my patient and her doctor received an email from Quest Diagnostic Laboratories that said she tested positive for COVID. However, we tested her on admit to the hospital and she was negative. After some research, we found that her doctor had canceled the lab order at Quest because she was admitted, and they never even ran the test, but reported her as positive. My sister went into a COVID testing center in Michigan. They asked her for insurance, which she doesn't have, and told her it cost $100 to get the testing done. This was after she had already filled the papers out, so turned it down and left the site without getting anything done. A few days later, they called her about her results. I also have a family friend who this has happened to in San Diego. Never took the test, but called him a few days later saying he was positive. And those are just a few of the hundreds of responses that we got when we put out this call to action.
Just get a phone number. I got it 4 times a day. Finally answered my phone number. It's somebody from Cook County. They are calling to check up on me to see how my COVID was doing, which we had, what, a month ago? When was it? 3 or 4 weeks ago, whatever it was. So I tell them I'm fine. They then ask me if I'd be willing to take a quick survey and jump on a website and film a quick video explaining to people the dangers of this illness. And she asked me from a 1 to a 10 how bad my illness was, and I said 0, because we didn't have anything. I had like a 99 fever. Christy had nothing. So she says on the phone, we can't do 0. I'm like, I didn't have anything wrong with me. And she's like, well, would you be willing to jump online and fill out a short form explaining that it was dangerous and that you did have a severe illness so that other people that have it will be more informed? How f***ed up is that?
So what does all of this mean? Well, it could mean a lot of things. One thing that it means is that as we've watched this surge of new cases across the country, specifically in the states of Texas, and in Florida, and in California, as we've watched that surge, there has been a new surge of lockdowns in place and governors reinstating orders to control people's behavior, telling businesses they cannot open again, telling schools they cannot open in the fall, which affects parents who have to work, affecting the lives and the economy of the entire nation. And it's based upon a surge in numbers related to coronavirus illness. The bottom line is that a true pandemic does not need any help from government officials or from clinics recording numbers improperly or from doctors writing the wrong cause of death on a death certificate.
A man dies in a motorcycle crash, but his death listed as a coronavirus death.
How are officials explaining this?
Well, Charles, they really haven't given us much of an explanation at this point.
A 90-year-old man who fell and died from complications of a hip fracture. A 60-year-old man dead from a gunshot wound to the head. These are some of the deaths in Palm Beach County recently and incorrectly labeled as COVID deaths in medical examiner records. The I-Team reviewed a copy of the Palm Beach County Medical Examiner's COVID death spreadsheet. It has 581 deaths listed, all of them tested positive for COVID-19. But CBS 12 News noticed 8 cases in which the person died of something completely different, like Parkinson's or a neck fracture, and COVID was not listed as the cause of death. We wanted to know why they were still being listed as a coronavirus fatality.
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
The cases of overdoses are accelerating.
Calls to suicide hotlines are up. More kids are going hungry during the pandemic.
1 in 5 American renters could be evicted from their homes.
But up to 121 million people around the world could be pushed to the brink of starvation.
When the coronavirus hit the U.S. this spring, more than 40 million people were suddenly out of work.
For the unemployed, the up to $600 a week CARES Act unemployment checks, they run out at the end of July. Millions of Americans are now in limbo as they struggle to maintain a roof over their head.
People are actually getting kicked out on the street.
She is one of about 28 million Americans at risk of eviction.
Job losses and economic hardship created by the COVID-19 pandemic could result in a 40 to 45% spike in homelessness nationwide.
Congress approved the pandemic EBT program last March. It's supposed to funnel money to millions of children who are no longer getting school breakfast and lunch, but people are having trouble getting that assistance, so they are turning to food banks.
Oxfam found that food crises in Venezuela and South Sudan have grown worse during the pandemic and warned that India, South Africa, and Brazil were seeing millions fall into poverty and hunger.
And unfortunately right now, because of isolation, because of job loss, it appears that these worst-case scenarios are happening.
Since the beginning of the pandemic here in Idaho, the number of domestic violence issues has gone way up.
Basically, the opioid epidemic is back since we went to these stay-at-home mandates.
We are seeing an increase in drug overdose and in suicides, not just here in Arizona, but nationally.
When is this going to get better? People are asking a lot of questions that we don't really have answers to at this point.
This is not a killer pathogen that is unusual in terms of how many deaths it causes. Nothing special happened. It was a fake event, if you like, in the sense that it was given a special name and it was used in propaganda to frighten us to think that there was a particularly dangerous thing happening that was very unusual and unseen previously. That's all a big lie.